Our main aim is to get injured workers better and back to work as soon as possible, and we think this will be a big step forward. We actually think it'll save injury insurers 10% of their claims costs. At the same time, it'll improve injured worker outcomes.
Hi, I'm Mariam Tadros from iCare, and today I am joined by Dr. Eddie Price, who is the founder of eHealthier. Welcome, Dr. Eddie.
Thanks, Marianne. I'm delighted to be here.
Now, Dr. Eddie, you've got a number of products under eHealthier. Could you talk to us a little bit about that?
Well, firstly, we were interested in what's known as value-based healthcare, which is a product that if you've got a work injury, say a back injury, they give you a questionnaire that is scored at the beginning of the process, and then after you've had your treatments, the score should increase. And there are a whole lot of these products that are called patient-reported outcome measures. So we've created an IT program that takes that into account, but it also has what they call a biopsychosocial component and the ability to set targets between the claimant and the provider providing the service. So that's part. But what we found was people didn't understand what value-based healthcare was, so we created training programs, one for the allied health professionals, and we're in the process, together with PIEF, of creating a program for claim services managers so they can be part of the PIEF offering of value of their training programs, and we hope we have a long and ongoing relationship with PIEF.
Right. And so with the patient reports, these are designed to support early interventions?
Well, the reason we think claim service managers should be involved, because usually they're assigned too late in the process. But as soon as the claim comes in, the claim service provider can assign to the claimant two such questionnaires. We suggest a generic one known as the Promise 10 that measures physical health and mental health, and one specific to the part of the body that's been injured. So there's different ones for the knee, the back, the neck. There's thousands of these validated measures that are now very accurate.
How do you deal with the subjectivity of a person's feelings or perceptions?
A series of scientific breakthroughs in what was originally called psychometrics to measure these things. It was applied to medicine in 1982 by a guy called Feinstein that called clinimetrics. And clinimetrics has been developed by universities around the world, and they say even though it's subjective, it's accurate or more accurate than blood pressure measures over the years. In fact, when any drug company needs to put a new drug on the market, they've got to test it with various PROM measures to see how it affects the patient's quality of life. So it measures what's called health-related quality of life, but eHealthier has also preventive measures and measures of social support or social determinants.
And is the biopsychosocial questions that have been introduced, is that more recent research, or has it come from the impetus and the rise of mental health injury or secondary psych injury?
It is more recent research, but there are now programs for questionnaires, for instance, for diet, and there's 10 or 12 of these to see. So, for instance, if a person gets injured and they're a 22-year-old fit man, and a person gets injured and they're 64 and they have 3 chronic diseases, they're new immigrants, they don't speak the language, they're likely to have different outcomes. And the biopsychosocial model takes this into account. So otherwise, you would expect the 22-year-old to recover much more quickly than the person who's alone, doesn't have any family, doesn't speak the language, and suffers diabetes, heart disease, and respiratory disease. So that's why we see the biopsychosocial model as important. In fact, TAC introduced what they called the National Clinical Framework in 2012, which introduced this biopsychosocial model. And unfortunately, to date, it's been more honoured in its breach than its observance, because it's been difficult to do. But the advances in IT make all of this realistic and now very accurate.
Why do you think that it has been difficult to implement these interventions?
Because the questionnaires have been long. Secondly, the doctors in particular have had this attitude against subjective measures, thinking medicine's based on science, and this isn't good science. But over the years, I've written 4 books on this subject, and the last book shows that, in fact, it's based on a new science known as complexity science and complexity medicine. But overall, the questions are simple, they're easy to implement, and it can be done on the claimant's own phone, and you can accumulate data by rehab provider, by insurance company, and so forth on how well they've done.
So with eHealthier, the accessibility for the injured person to complete the survey is made much simpler, more convenient.
Much simpler on their own phone, in their own time, and we suggest the first assignment is done early in the process so you can get early intervention to stop it escalating to psychological injuries. But everybody needs to be trained on this new methodology, and so we're organising a training program with PIEF for the claim services managers, and we've already got a training program for the allied health providers that's available online as a learning management system that they can do in their own time and get CPD points for it.
That's a really good call out because time is very poor. And if you're able to contribute to professional development in a way that'll be mutually beneficial, then hopefully it'll encourage more uptake and more use.
Yeah, well, they can do it in their own time from their own home, or they can do it with the backing of their employer, be it a rehab provider, a physiotherapist, a podiatrist, anyone like that can back them into doing it.
Yes. And with these particular measures, we know, certainly as being part of a jurisdiction, I know that metrics matter. And if we have a way to measure the impact that we're making for our community, it does support initiatives, funding, uptake, buy-in, training impetus, all of those sorts of things.
All of those things are right, but the fact that now it's so easily accessible, like everything else, it's the advance of IT, because there's complicated algorithms behind these measures, and this is done within seconds or milliseconds by the new IT. So this is immediately available to the claimant as well as to the provider or the insurer.
So the claimant themselves, the injured person, can see their own data and see their own progress over time?
They can see their own data, and if they do follow the National Clinical Framework, which, by the way, has been endorsed by all personal injury insurers across Australia, they would set a goal together with the injured person so that they're both moving towards the goal is how much they expect to improve by what date.
Yeah, I think that's fantastic. I think people want to see change, and we're so mobile adapted now. So if we think about apps, fitness apps, whether they're wellness apps, anything can be tracked now, whether you're watching what you eat or anything to do with health and well-being. You're now wanting to reward yourself psychologically with seeing your progress. So it's wonderful to be able to have your injury recovery progress available.
Yeah, well, we think it's wonderful. It puts the claimant at the centre of the whole process. Our main aim is to get injured workers better and back to work as soon as possible. And we think this will be a big step forward. We actually think it'll save injury insurers 10% of their claims costs. At the same time, it'll improve injured worker outcomes. So we're very excited at the potential, and we're more excited at being partners with PIEF in this future endeavour.
Yes, absolutely. Well, Dr. Eddie, thank you so much for joining us today and for explaining the versatility and the opportunities that are available through the eHealthier products.
Thank you for that. I trust that was understandable. You
Absolutely.
understood it quite clearly?
Yes,
Yeah?
certainly. Yes.
Okay,
Thank
great.
you
That's
so
good to
much.
know. Thank
Yeah,
you for the opportunity.
it was
Much
wonderful.
appreciated.